we go. And I'm going to do some housekeeping just for a second. Um, this is the seminar, a webinar, excuse me, on improving sleep. Next week, this is part of our webinar series. We're going to be wrapping up this quarter's webinar series with an in-person webinar at our seminar, excuse me, in the villages. We're going to have a seminar at 9:30 in the morning at 1 o'clock. So please feel free to join us if you're in that area, if you're near the villages in Florida. And then that evening, because of the ambiance of the Hurricane Ian, we had to move the terpenes webinar. So we'll be doing a terpenes webinar that evening for those who are interested in that particular subject. And that's going to be a webinar, not a seminar. So next Wednesday is going to be very busy. I do want to say that we are here really to answer your questions. And if you look kind of down over here, you'll see two little round bubbles about Q&A. Please feel free to ask questions. There are no such things as dumb questions or bad questions. I know everybody has information that they want to learn about. If you have some questions, please bring them out. That's what we're here for. And I do want to mention that tonight's webinar is being live streamed on Facebook. And after this webinar, you will get a copy of a link to the webinar itself that's going to be presented off of YouTube. You'll be getting a flip book, so you'll get the actual slides themselves and any background information. You'll see that as well. So we'll have some follow-up information that can make it a lot easier for you to not only understand it during the webinar, but afterwards as well. What are we trying to accomplish tonight? I think it's important that we really frame what sleep and insomnia is. I know it means a lot of things for a lot of different people, and I think in order to talk about a solution, we need to know what the problem is. So I think Greg's going to help us understand sleep and insomnia. We're going to then dive into how cannabis really helps improve sleep and insomnia, some studies and some research that's been done in that area. And then we're going to talk about how it works. In other words, as a patient, I always like to know, how is it working? What is it doing? Is it safe, for example, to use? We'll talk a little bit about that. We're going to talk about the different cultivars, the different products that you can use to help improve sleep. And then we're going to talk about specific products that specifically you may want to look for as you leave the seminar or webinar tonight. So that's what we're going to try to accomplish tonight. Let's jump into insomnia. Greg, you want to talk about this? I know this is something that's near and dear to your heart. There's a lot of people in America right now that are suffering from insomnia. Is that correct?
Absolutely. It's the most prominent sleeping disorder, probably in the world, but at least in the United States. And, all sleeping disorders, it's over a $400 billion a year problem. So insomnia being the most prevalent type of sleeping pathology, it's something to be pursued. There's so many lost work hours, things like that go on. And insomnia is not just having trouble falling asleep, it's having trouble staying asleep. So they call it wake after sleep onset as a form of insomnia. So both of those two different types of insomnia pool together into this entire pathology.
Wow. Yeah, I know there's been a lot I know that it's a serious problem. And again, like I mentioned, it's something that a lot of people keep bringing up to me. So let's kind of dive into this a little bit. I know that one of the reasons why people have trouble sleeping is due to pain and anxiety. And it goes back to what you said earlier, Greg. It's not a matter of falling asleep, it's a matter of staying asleep. But define sleep for me. You kind of talked about insomnia. How does that relate to sleep?
Sure. So when anybody's asleep, there's a difference between being asleep and being unconscious. Being unconscious is a pathologic kind of finding where you can't be aroused. But being asleep, for the most part, is something, it's an arousable condition that is a restorative side of just about all animals anywhere, and a lot of other species, is the opposite of the wake state. So good, healthy, restorative sleep is important to maintain the awake state. And when there are some types of dysfunction in the wake state, we always look to sleep to see what happened in that. And probably historically not enough looking into sleep state, but when I say restorative, it means a resetting of the whole neuronal environment. So our neurons are cranking and cranking and cranking during the day, and it's thought that it builds up this compound called adenosine during the day, and that adenosine has to be soaked up, and some of the excitatory amino acids like glutamate have to be soaked up and restored, during the sleep cycle.
So your body's basically resetting itself. Is that correct?
That's absolutely right. It's resetting itself.
So that goes back to the reason, why we sleep. I know that when I was researching this, I found it interesting when looking at the reasons why to survive is actually one of the top reasons why we sleep. Why don't you talk a little bit about that?
That's like a, well, how long can you stay awake kind of thing. There is a disorder, fatal familial insomnia, to where there's like a lesion inside the brainstem that can prohibit you from going to sleep, and you would die within a few months. So that there is a limit. So it is necessary for survival. And speaking from like a, teleologically speaking, animals that enter a sleep state, they're not just one stage or state of sleep. They move from this light sleep to very deep sleep, or restorative sleep is the deep sleep, and into dream state sleep. So moving through different sleep stages, they come closer to consciousness.
Mhm.
And it's thought from a historical perspective that they sample the environment to see if it's safe to continue getting into a deeper stage of sleep, to where it's difficult to arouse from.
That's really
So there
interesting.
was a lot of different things about sleep, but it's all to maintain a good, healthy wake state.
Mhm. Yeah. It also helps keep your nervous system functioning, and that's really important. I know that when they talk about healing, when you talk about losing weight, really sleep is really an important factor to that. It's kind of interesting because when people want to lose weight, they always go out and they exercise and do a lot of jumping around, and really sleep can help them just as much as the exercise.
Especially in the youth, in pediatrics, and in infants, because the bottom line there is really important, because it's not just growth hormone, but growth hormone is being released during that stage 3, stage 4 deep sleep
Mhm.
that helps with growth. But without this good restorative sleep, your immune system starts to like decompensate.
Right.
Things start going wrong. So it's incredibly important that good, healthy sleep happens, and not just that thought that you could, just if how much time you spend asleep. You have to go through the different sleep stages as well.
Sure, sure. And also the duration. I think you were talking about earlier. One of the keys. What I've learned from you in previous webinars and just in talking, really, it helps your neurons to be able to, how should I say, control your sleep. It really helps your immune system and helps you with a lot of mental and physical disorders.
Yeah, and again, they looked at sleep in a way, through the animal experimentation. They tried to figure out exactly which parts of the brain and the neurons were responsible for being awake, and which parts were responsible for being asleep, and also going through the different stages of sleep. So it's interesting that they're not the same. There's different pathways for like different parts of sleep as well, but
Yeah.
you need it for the immune system, like responses, and to have everything together inside the body to fight off infection.
Mhm.
And we've looked at some disease states to find out where they are in as far as sleep goes.
Mhm.
So sometimes, insomnia and other sleeping disorders precede like a psychological problem, and sometimes it happens after the onset of a psychological problem, but
Mhm.
they usually coincide, especially
Right.
like bipolar disorder and things like that. The sleep
Mhm.
problems go along with anxiety. Some of the other ones that you've got listed, pain caused by cancer,
Mhm.
definitely has like a component of like sleep disruption.
Wow. Yeah, it's really, I think it's really important. I know that getting a good night's sleep and candidly napping, I think it's something that can really help you quite a bit as well. And you're going to talk about napping, I know, in a little bit. But let's talk about sleep time. I found this slide to be very interesting when we put this together.
You know, the thing that jumps out at everybody is like infants, toddlers, pediatric patients. By this graph, which is very true, they sleep a lot more than older people. But
Mhm.
it's when you're in that 14 to 18 age range right there, where it still says that you need up to 10 hours of sleep. That's when the teenagers are starting to move into high school and things, and
Right.
social interaction affects the amount of the duration of sleep they get. And then you're still into that kind of thing called a limit setting disorder,
Mhm.
where the parent is there to still guide them. It's like, no, I said go to bed.
Mhm.
That happens with a 3-year-old that keep
Mhm.
trying to get up because you're awake, and you got to keep pushing them back into bed, or whatever parents do to make them stay asleep. And they
Mhm.
don't include things like napping in here. About 3 naps for the infants that start to dissipate by the time they're 2 and 3 years old, where they
Mhm.
get 1 nap, and so that starts to decrease. And then when we get older, sometimes a small short nap during the day
Mhm.
15 minutes, 30 minutes is okay, as long as it doesn't affect your going to bed that night.
Yeah, good point. That's a good point. Well, let's talk. Yeah, I think that's a very good point. Let's talk about, we talked about the cycles, the circadian phase, and I know this is fascinating because we all go through it, but I don't think we understand it. And I think when we talk about medical cannabis and how it can help, it really taps into this. So why don't you give us a little bit quick lesson on the circadian phase?
Well, you see at that, that where it says 23, probably 2300 hours, 11 o'clock at night to 7 a.m., where it says that's where sleep takes place at that peak, where S is that sleep pressure that builds up during the day, where
Mhm.
adenosine is accumulating in the brain. And the circadian rhythm, the C curve there, is going up in the morning after 7 a.m., then it drops back down towards the evening. Now
Mhm.
you have to be on the back side of that circadian curve with enough sleep pressure built up during the day to fall asleep naturally. And
Right
this
in
is
here.
where people can go wrong. Yeah.
Mhm.
You can either take a too long a nap and reduce that pressure to fall asleep, and then you might think it's insomnia, or
Mhm.
your circadian rhythm could be thrown off because you wake up late, or you wake up in an environment where you don't get any bright sunlight to shut off melatonin production in the brain
Mhm.
during the day. So your circadian rhythm can be off, and some of the circadian disorders are like advanced sleep phase syndrome, like farmers,
Mhm.
which wake up really, really early in the morning, or delayed sleep phase syndrome, where adolescents and teenagers, college age kids, they'll go to
Bartenders.
sleep 2 o'clock in the morning
Yeah,
and their
bartenders
circadian.
and service industry people that are have to work till late.
Right. Yeah. So if you throw off either the circadian rhythm curve or your sleep pressure to fall asleep, it's not insomnia when you've got issues like that.
It's very fascinating. So let's talk about how you sleep. I know we've heard about REM, non-REM sleep, because really this has a lot to do with how cannabis can help you. It affects the different types of sleep.
And it does. Cannabis, for one, the molecule, the THC molecule resembles tricyclic amines like protryptyline, amitriptyline, Vivactyl, and those antidepressants have been used to suppress REM sleep.
Mhm.
So, going through the literature, you can see that cannabis can suppress rapid eye movement sleep, and
Mhm.
we've used it in sleep medicine, things like the bivactyl protryptyline to suppress REM sleep, and they do it by accident sometimes from the psychologist side, psychiatric side, because they think you're depressed. But in our world, when you're in REM sleep, you're paralyzed.
Mhm.
It's a flaccid paralysis, and you lose muscle tone to your upper airway, and people
Mhm.
have more sleep disordered breathing in rapid eye movement sleep.
Mhm.
So if you suppress REM sleep, you suppress some of that sleep disordered breathing that happens in REM, and they start feeling better because they don't have that much sleep apnea that's happening in dream state sleep. And
Mhm.
they go, well, see there, I told you, that you were depressed. It was like, well, I didn't think I was depressed, but
Mhm.
but there are things that cannabis can do, and it helps with sleep onset, and they're still looking at to tease all that out. Is it the true THC, or is it the cannabinoids that are working with sleep onset?
Yeah, it's interesting. Here's an interesting chart you showed me. This is very fascinating. Explain that to us.
Yeah, where you see on the left side where it tells you, reads off where they are, the left eye, right eye. So that you've got these leads that are looking at the eyeball motion. So when you move over further to the right on the eye leads, you can see those big deflections. And that's the phasic eye movements of rapid eye movement sleep. So we can see that in a sleep study. And then down below that is the electromyogram, the EMG signal. And you see how dense the signal looks on the left side. And then it starts to lighten up underneath those phasic eye movements where REM sleep starts. And that's the flaccid paralysis, and that's the loss of muscle tone that you
Mhm.
can see from the EMG signal. Now, the EEG, the electroencephalogram, the brainwave signals,
Mhm.
C4 to A1, F4, O2 to A1, those show a sawtooth waveform pattern that's underlined.
Mhm.
And that's, it signifies rapid eye movement sleep, because you can have phasic REM or tonic REM, where there's no eye movements, but you will have those sawtooth movements so you can identify rapid eye
Mhm.
movement sleep.
Interesting. This is very interesting. So you're able to actually scientifically see how somebody's sleeping and see which stage they're in.
Oh yeah, they did a big study. Uh, I can't say that they won a Nobel Prize, but they were waking people up whenever they saw this brainwave pattern and
Mhm.
asked them if they remember their dreams.
Yeah,
So it was pretty interesting, but that was probably early 1900s when they were doing that study.
sure, sure. Now, non-REM sleep, I know that when I started working on this a couple years ago, I heard about N1, N2, N3. Why don't you kind of explain the non-REM sleep? Because this is important, I think just as important as well.
Yeah, sure. There's like when you look at sleep, there's REM sleep and non-REM sleep. So non-REM includes light sleep and deep sleep and this sort of N2 or transitional sleep.
Mhm.
And most sleep is this N2 transitional sleep, but non-REM is obviously everything but REM.
Mhm.
And you can still have dream periods through there, but we look at this because you can start off from being awake in bed, relaxed,
Mhm.
and if you're not doing math problems in your head, your brain will go into this alpha rhythm.
Mhm.
That's a 10 cycle per second rhythm. And your eyes will slowly move from side to side with your eyelids closed. And we can see those eye movements look like roller coasters
Really
on the
interesting.
screen. And then you slide into the stage one or N1 sleep or light
Sure.
sleep where it's easy to arouse.
Mhm. Interesting. Interesting. Well, so here's your different stages that you were talking about.
Mhm. Um, So light sleep in general, 5 to 10% of total sleep time. If you look at this graphic here, this figure, but keep in mind that if you have chronic pain, if you have like problems with insomnia, that percentage of light sleep starts to shoot up, and
Mhm.
then you don't feel very restored in the daytime. You'll
Mhm.
feel fatigue. Fatigue is the first thing that you feel from loss of like proper sleep, or for problems with like chronic pain, but those drowsy, slow rolling eye movements transitioning to the mixed EEG frequency, that's what
Mhm.
we generally see in light sleep. Now,
Mhm.
skip down to like N3 or stage 3, stage 4 sleep. These are our large amplitude slow waves. So now we're at 1 to 3 cycles per second. And it's like the deepest stage of sleep. And who gets that mostly? The babies, the infants, the 3-year-olds.
Mhm.
And that's where a lot of the cognitive understanding and learning takes place, is when you get a lot of deep sleep. It's like that old adage, you can't teach a new old dog new tricks. You lose deep sleep as you get older.
Oh,
And
really?
so
Interesting.
those young guys, the babies and the little kids are sponges for knowledge.
Yeah.
So it starts to go away after it doesn't go away, but it starts to be reduced in the percentage by the time you're like, about 25, 30 years of age,
Sure.
upwards of like 70, then you just don't see as much deep sleep as you do in an infant, definitely as you compare to infants.
Very interesting. Very interesting. And again, here's your charts to show you that again, your left eye, right eye, and EMG.
Yeah, and see, when you're looking at the left and right eye, that's just spillover from the electrical signal coming from the brain, that C3A2 channel.
Mhm.
And you can see the EMG is thick, and so there's still muscle tone there, but you
Yeah.
have those large amplitude slow waves,
Right
and
here.
that's the true restorative sleep. And most N3 sleep happens in the first third of the night. So if you're in that deep sleep, and then you get most of that restorative sleep in the first 3 or 4 hours that you're asleep, you feel like you can keep going. But it's also important that if you're awakened from that deep sleep, one of the parasomnias they call it, it's like this. You can almost develop a combative attitude, and it's difficult to arouse. So
Mhm.
you could be shaking somebody, and then they'll wake up and won't know where they are, or
Mhm.
can't speak for a few seconds, and is being aroused from that really deep sleep.
Yeah.
And that's what happens. So easy to arouse from N1, very difficult to arouse from N3.
Interesting. That is interesting. So really, and this gets back to you talked about the circadian rhythms, which were really not on a 24-hour clock. I'm gonna let you talk about that. That's your deal. But really it has to do with our biological clock. And I say that because I've worked when I was young, I had to open up a golf course at 3:30, 4 o'clock in the morning. And I know that was throwing my sleep patterns off for quite some time. And when I was traveling in my professional life, I ran regions, Canada, which had six time zones, and Latin America that had five. And it worked havoc on my biological clock. Let's explain a little bit about that.
Yeah, so when we say biological clock, circadian rhythm, it's not just a nebulous term that we're throwing out there. It really is genes inside the cells of the brain, parts of the body that are making proteins. And then during the day, they would be breaking down proteins. So you have things like period gene, timeless gene, clock gene. So all of these genes inside, cell nuclei are making proteins that are getting broken down over a period of time. So, that's affected by one, like getting sunlight, like I said, to shut down melatonin production,
Right.
that suprachiasmatic nucleus. And the other is social interaction. It's another pathway to cycle you up on the circadian phase.
Mm.
So those are the important things about, this rhythm. It is a true rhythm. You try to get tied in with the sun, and where they say it's like 24 or 25-hour cycle, the idea is that they stuck a bunch of scientists inside a cave and they let their rhythms run free, which means nobody had a watch. Okay. So they were just going until they got sleepy. And they found out that those rhythms can be like a free running rhythm to where it's a little bit more than 24 hours. So the body's still timed to like go that way.
Mhm.
And people that have no vision at all, the blind people, they sometimes have that free running rhythm, and their timing is adjusted to social interaction as opposed to like sunlight shutting off melatonin.
That's very interesting. That's very interesting. Let's talk a little bit about. I know you were telling me about this when we were preparing these webinars, about how you actually quantify sleep with patients.
The neat thing about sleepiness, let's say, if you compared sleepiness to pain, you would say, like, how much pain are you in? It's like, well, it's hard to describe. It's like 0 to 10, how much pain are you in? Well, almost 7 today. And it's the same kind of thing with sleepiness. It's almost like a subjective measure of sleepiness. How sleepy are you? It's like, well, I'm super duper sleepy. It's like,
Mhm.
so it's hard to like get a handle on how sleepy somebody really is. You can look at them and see that they're dozing off.
Mhm.
You can try this Epworth sleepiness scale on the right side of the screen, but it's what we got right now, the Epworth sleepiness scale, to look at how sleepy you are. So 0, 1, 2, 3, your chances of dozing off or sleeping,
Mhm.
sitting and reading, watching TV, a public place like a movie theater, passenger in a car. So the holes in this scale is, what if you don't watch TV, or what if you don't ride around in a car, and they score themselves 0, and it doesn't look like that you have any sleepiness at all. And
Mhm.
so that's the problem with it. Now, what we do in the laboratory is, if you heard that thing, is like, I fall asleep as soon as my head hits the pillow. Not good, because if you fall asleep less than 5 minutes after lights out, that's almost a pathology in of itself, that you fall asleep too quickly. It's
Mhm.
not good. So it takes people about 15 minutes to fall asleep naturally.
That's part of the circadian cycle that you were showing, that downward slide, right?
Yeah, exactly. It takes time for things to adjust. And, that's the difficulty with insomnia, is to clear all of those thoughts out of your mind, and to like, to let sleep overwhelm you. But it only works if you have enough sleep pressure built up during the day.
Yep.
And that means you didn't take a long nap, and you have your circadian rhythm going up and down the right way. And
Right.
that means about half an hour of bright indirect sunlight in the morning, and again in mid to late afternoon, the sunlight, to help your circadian phase get the timing right. And then
Interesting.
sleep pressure to like get everything set for you to fall asleep naturally. But
Mhm.
see, when those things are off a little bit, that's where, cannabis does play a role to help push you over the edge.
Yeah.
Without something, like people have used, is a lot of, the Valium class of drugs.
Mhm.
And those can be addictive. It's a true physical addiction, to where, you can have like some serious problems If you've been taking it for a long time and stop cold turkey, not a great idea at all. You'll have big times with those benzodiazepines. So in my mind, occasional trouble with insomnia, the kinds of products that you guys are going over this evening are just incredibly important for that problem that's affecting most Americans in one way or the other.
Cool. Well, Greg, you did a great job of talking about sleep. I know Lisa and I are going to jump into how cannabis and the research that goes behind it. I think you have a couple of kids at home you got to take care of. Is that right?
I do indeed. My wife's out of town, so I'm going to just make sure they're not burning the house down. And they've been sending me text messages while I've been talking, and I've been sending everybody, can't talk now. And they knew that I had a lecture to do, but I'm going to be involved. Yeah.
You're going to join us by phone for answering questions. Is that correct?
Absolutely.
Great. Greg, thank you very much. And we look forward to you joining us by phone. And Lisa, why don't you and I jump into the cannabis side of this? There's been research that's been done on cannabis. Why don't you talk a little bit about that? Because we've reviewed some of the various research that's done, especially the role of the endocannabinoid system. ECS stands for endocannabinoid system, and how its role in the circadian rhythms comes into play.
Yeah, well, one thing that's wonderful about the endocannabinoid system is that it's basically designed to create homeostasis or balance throughout the body.
Mm-hmm.
And whenever something is out of balance or out of whack, it can perform all these really awesome functions to bring that balance back.
Mm-hmm.
And a lack of sleep, as was very much demonstrated previously, will definitely, harm the body. Reduces your immune system, for example.
Mm-hmm.
And cannabis can interact directly with this system, the ECS.
Mm-hmm.
And so it's going to bring that balance back, whether, it's the pain that's causing you lack of sleep or just not feeling that sleep pressure that Greg was talking about and push you over the edge.
Right.
And one thing that's really interesting is not only is it backed up in terms of research showing that it works on the body, but it's backed up in terms of when we do these surveys on people of why are you using cannabis as a sleep aid is consistently the top three. It's the number 2 reason why people utilize cannabis is because they need help with their sleep.
Mm-hmm. Cool. Yeah, I know. And again, if you take a look at THC, has been known to really help people, help people relax. It's what they call the sedative properties, but also it helps reduce the amount of sleep apnea that people have. And of course, working THC and CBD working together naturally work as a team. 1 and 1 is 3. And in this particular case, it helps with sleep onset and also what they call the slow wave sleep, which is what Greg was talking about earlier.
Yeah, they do. They work together really, really well.
And I think it's cool that we have some studies that really point that out. Also, when it takes a look at, if you use cannabis from a recreational standpoint, does it help with sleep? Do you want to talk a little bit about this? Because this is a study that was done in Colorado.
Yeah, and so they went ahead and they did a tally of how many over-the-counter sleep aid drugs were being sold. And they found that after legalization went through, there was over 200% reduction in those purchases. And so that tells us a lot. That tells us that instead of going and buying those, physically addictive drugs that Greg was talking about, instead they're turning to cannabis. And since those sales didn't go back up, we can pretty fairly assume that, it's working. It's working for people. And we've seen similar, studies here in Massachusetts and, even in Canada, where when you have medicinal cannabis or even recreational cannabis, the amount of prescriptions, not only for sleep, but for pain and antidepressants, they drop really, really dramatically.
I know the number of opioids that are used drops dramatically too, and that really helps.
Oh, yes.
Again, getting rid of inflammation, getting rid of pain does a lot to just help you sleep, gets you to relax, helps your body get in a state where you can fall asleep. If you're in pain, it's going to be hard to fall asleep. It's just
absolutely.
And this really helps quite a bit. So, question, is it addressing pain? Is it addressing sleep? And the answer is, who cares? It's addressing both and it works. That's what's important. If your objective is to get sleep, this works. Is really, really important. Let's talk about the endocannabinoid system because not many people have really heard about it. I'm going to talk about it in just a second. But really, the endocannabinoid system brings your body into what they call homeostasis. This is something that helps you stay in balance. And I know that the American Sleep Association has done a lot in this particular area. Why don't you talk a little bit about that?
Yeah, and so when your body is out of balance, out of homeostasis, these different receptors within your body, they sort of sound the alarm. And then it can tell your body to do all these various things to sort of, let's bring that balance back. And so one thing that is really important, I feel, is if you're interested in cannabis for a sleep aid, is to sort of self-evaluate a little bit and try to see if it's something like pain that is interrupting your sleep, or maybe it's anxiety, because that might, help you choose what kind of products you're going to be going after.
Yeah.
And so CBD is really great at reducing anxiety and, especially reducing inflammation, which causes all kinds of pain. And so if you're having really inflamed joints, that might be a really great option. It's something that has a good amount of CBD. And THC is really excellent at blocking pain signals from reaching the brain. And so if you're having, nerve endings firing off these pain signals, it can basically turn that dial way down and allow you to sleep that way. And having them both together is great because then you're sort of coming at it from both angles.
Sure.
And so if you can find a product that has a good amount of both, that's going to be a really great spot to start if you're a little unsure over why are you having problems with sleep.
Sure. So that's really important. So one of the things that I found is that when I got involved in medical cannabis, which was about 10 years ago, I heard a lot about the nervous system. As a kid, when I grew up, we heard about that we all had a nervous system. I call it the body's cell phone system. If you hurt your finger, you hurt your foot, you hurt your knee, your body knows it, your brain knows it. It kind of communicates what's going on, again, through electrical signals to your spinal cord and that type of thing. Western medicine studied the nervous system for a long time. But what was very fascinating is they didn't really study the endocannabinoid system. And the reason I say that is because when your body has a problem, Houston, we have a problem, whether that's pain, whether it's inflammation, whether it's indigestion, whether it has to do with your, the IBS, your gut. It tells your brain that it has a problem. What does your brain do with it? And they never studied what. I mean, they studied some reactions to it, but what your brain really does is it hands it to the endocannabinoid system. And your endocannabinoid system says, we have a problem. And it generates endocannabinoids, sends them to the bloodstream of that part of your body to put you back into homeostasis. The endocannabinoid system is what affects pain, anxiety, memory, appetite, inflammation, your immune system. This is how your body regulates itself. And I find this to be very fascinating. It was actually found more in the 1940s, but because of the war, it wasn't studied. And it wasn't until Raphael Mechoulam got involved in cannabis that this really came out and became very popular. And now it's being almost embraced by the medical community as, gee, look at what we just found. We found these new sets of receptors called CB1 and CB2 receptors that control our bodies and do so much for us. And so we talk about the endocannabinoid system. For a lot of people, they've just heard about it. It's just brand new. Trust me, it may be a new term that you heard, but you've had it for a long time. Okay.
Millennia.
Every mammal has it that's out there, which I find very, very fascinating. So it is something that controls your pain, anxiety, memory, appetite, your whole body. And when your body is balanced, they call that homeostasis. And that's what we're really trying to achieve. That's what we're trying to achieve with our bodies, with a lot of our medical conditions that are there. So what's interesting is the cannabis plant itself produces over 200 known cannabinoids. Now they're discovering more of them each year. Why is cannabis such a big deal? Well, I talk about cannabis as being kind of a medicine cabinet because these cannabinoids that are in cannabis, when we have these endocannabinoids in our body that our body produces to be able to help itself stay in homeostasis, what we have found, or what the scientists have found, is that phytocannabinoids, which are in cannabis, exactly has a structure that's exactly identical to the endocannabinoids. So what's interesting is by putting that in our body, what we're doing is we're giving our body the endocannabinoids or the phytocannabinoids, the resources it needs to address the issues it needs to get into homeostasis. Now that is very, very fascinating. And that's what they really found out about that That's why cannabis is such a big deal, because no other plant that we know of really has that many medical properties that have been out there. And that's why it's been used for literally thousands of years, over 5,000 years. That's why so many people use it that's there. I put this little picture down at the bottom. A lot of people ask, why do I do that? These are the trichomes. This is what you see. Everybody, when I know a lot of people new to cannabis say, I'm looking at these plants and they look like these little weeds. Well, they are weeds. That's why they call it weed. But also, it's interesting that those trichomes are really what it's all about. This is what you, for example, at Insa, this is where you get your medicine. Why don't you explain that a little bit?
Yeah, so the trichomes are where the cannabinoids, but another way to think of those are the active ingredients of cannabis that give it its, effects that you have heard about. And it's also where something called terpenes, which we'll talk about in just a bit here, are
Right.
created. And
Right.
so if you've ever seen cannabis before, even in its dried and cured state, if it looks like it has like a frosty appearance to it or almost like a little bit of sparkle, that is the trichomes. That is what we're looking to encourage the plant to produce, because
Yeah.
that's where the good stuff lies.
Right. That's really cool. By the way, I'm going to answer one question. Stephen, you asked a question. Can I access this presentation or transcript later? The answer is yes. After this, after we finish tomorrow, you'll receive an email. Tomorrow or Friday, you'll receive an email that'll have again a link to this presentation, this video on YouTube. You'll get a copy of the presentation in flipbook format, all the resources that are here, and an information about Insa and about Greg and a few other things. So you'll get a nice follow-up email that has everything that's there. And so the answer to your question is yes, you'll be getting it later. It'll probably by later, let me define that, probably be more like Friday. Although we try to get it out as soon as possible. So let's go back to this if we can. I talked earlier about really cannabis as being a medicine cabinet. I had a doctor who actually described this for me. And when I thought about it, I thought, this is really true. We know that there's 450 medical properties associated with cannabis. If you look at this little animal here on the right, this little guy that's here, this was a paper. This is taken from a graphic taken from a paper written by a doctor, Paul, who's actually wrote a paper 77 pages long and talks about how cannabis, the research about how cannabis affects each of these different areas. And this was actually published 6 or 7 years ago. So today there's obviously more research that's out there. I know they haven't updated it because there's so much research, but really Paul Armentello, and also for down here you see Greg Carter and Dr. Sulik and Dr. Goldstein were the ones who put this together. They've actually showed here's how cannabis helps the various parts of your body for different medical conditions, which is really, 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 really fascinating. It not only does it have medical properties, it has 120 cannabinoids and 100 different terpenes. So that's that we know of, and those are the ones that are being studied. But put together by being able to use, for example, CBD with THC, both of them have properties to help with pain and inflammation, but one and one makes three. They complement each other. They work together. I know CBD looks at counteracting a lot of the psychotropic, the high effect comes from THC. So it makes it easier for everybody to use this and stay cognizant. But why don't you talk a little bit about the entourage effect? Because that's really what happens when cannabinoids work together.
Yeah, and so like you stated, the entourage effect is excellent because these different compounds that are found in the plant actually help each other out and amplify, the effects that it can give and the potential benefits that are there. So, you say 1 + 1 = 3. Another way that we like to say it is that the whole is greater than the sum of its parts, meaning that CBD is more effective at, anti-inflammation when there is a little bit of THC present. There's
Right.
been a study recently that was released that really confirmed that.
Right.
And, THC can be tolerated in higher amounts when there is that CBD that's present because, it's not going to be as inebriating and intoxicating. And all of the cannabinoids work well when there are terpenes present.
Mhm.
And they're still trying to figure out exactly why that is, but it has
Mhm.
been demonstrated in studies that when there's the presence of terpenes, these cannabinoids definitely do their thing even more efficiently.
Right. Well, what's interesting is that when when the endocannabinoid and a lot of Raphael Mechoulam's work came out, they talked about the CB1 and CB2 receptors, and these are the receptors that help both with the mental faculties, CB1, a lot of the indigestion, your digestive system. That's where the CB2 receptors come into play. And both CBD and THC affect those receptors, no question. But over the last couple of years, we found out that CBD also does a lot to really help the various other receptors in your body. You know, the 2A2s, the GRP55s. Let me give you a little chart on that. What they found out is that CBD and cannabis affects all those receptors, not just CB1 and CB2. And so if you have trouble, for example, with, and I'll give you a few that are here. If you have problem, you say, with pain, and really you talk about body temperature, you talk about seizures, you talk about epilepsy, that type of thing. We know that CBDV helps considerably with that because it's affecting this receptor right here. We know that these receptors are receptors that control, although it talks about detecting your body heat and temperature, it also regulates pain, which is very, very interesting. The COX-2 receptors tied to CBDA helps with inflammation, nausea, mood, that type of thing. It's really interesting how you go through a lot of this, and it really talks about how it helps with a lot of different areas, anti-cancer, for example, epilepsy, convulsions. This is all the receptors that are associated with that, and these are the products. These are the cannabinoids in cannabis that actually affect those. And it's something very fascinating that's really come up. Jay, you talked about asking, we're going to talk about CBN. Yes, we are. And Carolyn, we're going to address your question as well. We're going to address all the questions. Also, Joe, your question about neuropathy. So hang in there. We'll be there in just a second. I just want to get some basics in there because it'll help make our answers a lot more understandable when we do that. Let's talk about cannabis. I know when I got involved with cannabis, I got, again, as a college student, I heard about indicas and sativas, right? And when I got involved 10 years ago, it was still indicas and sativas. We really don't hear much about indicas and sativas anymore, fundamentally because what we found out was in cannabis, we not only have indicas and sativas, we also have terpenes as well as the cannabinoids themselves. And these are very, very important. The terpenes are really a part of the cannabis plant that really is like the GPS. This is what causes a lot of the healing of the medical cannabis product. If we get the right terpene for your particular medical condition, cannabis will help you. If you use cannabis and you don't have the right terpene, it probably won't help. So I have some patients who come to me and say, gee, Mark, I used it, it didn't work. And when I look at the product that they were using, and I look at the terpene profile of that product versus the condition that they have, there's not a match. So no, it wouldn't work. The minute we change to what they're using, we bring some terpenes into play that address their condition, all of a sudden, magically, cannabis works again. And so what's really important, what's happening today in the industry, we're right on the precipice of going from strains to what they call cultivars or chemotypes. What they're doing is they're saying that particular product that you're buying, that flower, that vape pen, that edible or whatever, what is the fingerprint? What is the chemical fingerprint? What is it going to do? What are the terpenes and cannabinoids going to do? What condition does it address? And really, we're just on the verge of really cracking through a lot of that. I gave you a chart earlier about the different cannabinoids and how they affect different receptors. I think probably within 10 years, you'll walk into a dispensary and be able to say, give me something for sleep. And you'll have a product on the shelf that says sleep. Okay, which is interesting. I mean, CBN is kind of known for that, but it's interesting how they're really diving down to find fingerprints for that. You're seeing that at Insa, aren't you?
Yeah, absolutely. And that's one thing that I absolutely love working with Insa about is that we actually really do care about the terpenes, and we talk about it a lot. We do a lot of training with our team members so that they understand what the different terpenes are doing, and they encourage, the patients who come in to sort of take stock of what they're responding to. And so if they notice that a specific cannabis is really helping them, then we want them to look at the terpenes that are present, which we actually do put on the label. And that way they can have an understanding of what they're reacting to. And that way, when they go into the store again, they can find something that's high in that terpene, and the likelihood of it having a really positive effect, is going to be stronger.
Right.
We say that terpenes are basically responsible for the different personalities that different kinds of cannabis has.
That's a good description. Yeah.
Yeah. And so there's some that make you really energized, but in this case, we're looking for the opposite. We're looking for things that help us relax and, get ready for bed. And so there's a certain terpene profile that's going to definitely encourage that over another one. And so definitely when you're going into a dispensary, talk to the people you're working with and let them know what you're using it for. And they should be using their terpene knowledge to guide you to an appropriate product.
That's the objective, no question.
Yes.
And then your sweet spot is where, if I take this much of the product, it really helps me get the reaction that I want. I know sometimes you can take not enough. And then of course you can also take too much.
Yeah.
You get too much, it can cause anxiety, and it can actually work the opposite effect. So really trying to find out how much you take and when you take it. I know there's some questions here about using the eyedroppers. We're going to address that. It has something to do with that. It's really trying to find your sweet spot and what works. And your sweet spot can move, can change as you lose weight, as you diet, as you get in better shape, or go the other way. These all change. So it's really something to really stay on top of as far as what's there. We talked about terpenes. I am a huge terpene fan, and it's something to really pay attention to. Next week, we're doing a whole webinar on terpenes, and I think it's probably the most important webinar that I actually do, because terpenes are, as you mentioned, I call it the GPS. These are the products that really help you. Now, when it comes to sleep, which terpenes do you look for? These are the big 6 that you should be looking for. I know that there's linalool, myrcene. Lisa, tell me a little bit about these.
Yeah, and so, I do just want to just say that people do react differently to different terpene profiles. And so what works for one person may not necessarily work for another, but this is definitely a really good foundation to start with.
Good starting point. Put it that way.
Exactly. And, this is, relatively what most people will find. But, if linalool, for instance, isn't giving you that sedative feeling, don't feel bad. Don't feel like there's anything wrong with you. You just got to find a different terpene that's connecting with your unique system. But speaking of linalool, yeah, that's probably one of the ones I would recommend the strongest. It's very relaxing. It's the same stuff that's found in lavender. And as most of us know, lavender tends to be really calming and soothing. And so if you can find, a cultivar that does have a high amount of linalool in there, that's going to be a really great spot to start for, a sleep product. Also, as I mentioned before, you're going to want to take stock of why you're having problems with sleep to begin with. And so if you're having problems with pain, then maybe something like the caryophyllene or caryophyllene, depending on how you want to say it, is really great at reducing pain for a lot of people. Same thing with myrcene. And so, these are really great places to start for sure. And a lot of the time, a trick that we have is just smell it. Just smell the flower when you're coming into the stores. We say that the nose knows. And so sometimes if you are really reacting to a specific flower that, wow, this seems to be making me, attracted to this for whatever reason, there might be a very good reason. Your body might be missing out on some of the things that those terpenes are providing. And so that's a great way of figuring this out as well.
Sure. I know this is really critical. If you take a look at, linalool does a lot to relax you. Myrcene does an awful lot to help relax. One of the things about pinene is actually is more energetic. Okay, It helps you, it brings back memories and things like that. People that are suffering from PTS, I don't recommend that they use anything with pinene in it, because it could bring back memories that they really don't want to bring back. But a lot of these have to do with, does it relax you? Does it stimulate you? Terpene, for example, is a great sedative. Same thing with linalool here. Oh, sorry about that. Same thing with myrcene. Okay, when you get to caryophyllene, you get to humulene, you get to pinene. They're more what we call the sativa leaning, meaning they get you more excited. They give you more energetic that's out there. So what you're doing is you're looking for products that are there. I know, Marguerite, you asked a question that says, I use CBD tincture sativa and with some THC. It's very effective. I moved to Texas with a low THC state. It doesn't really work for me. Why is that? Well, it goes back to something that's very, very fascinating. And that is that the question is, it's not a matter of just the THC. It's a matter of what's the terpene profiles that are out there. And I am sorry, I think politicians ought to stick politicking, and they ought to let doctors and cannabis practitioners like myself do our job. Trying to tell me, or trying to ignore the science is not the best way to go. I'm sorry. I just have that feeling that we should pay attention to the science. The science has told us that if I have the right terpene profiles, in other words, if you take a look at how effective it is, what it does is it'll help you get your sleep. So you're talking about using CBD, it works, and a lot of the edibles don't work. Why don't they work? Because a lot of edibles don't have any terpenes in them. There's a lot of dispensaries that make edibles that are 100% THC and no terpenes. That doesn't do it. That doesn't do you any good. Pay attention to the terpene profiles that you're buying, because companies like Insa have terpene profiles with their edibles that you should pay attention to. That'll help you. That'll help you get some sleep. That's out there. This isn't a really. This is where the difference between rec and medical come into play. Medical folks pay a lot of attention to terpenes. Rec people pay a lot of attention to THC levels. How high can you get? It's kind of like I'm looking for 151 Bacardi. On the other side of the coin, if you're trying in the medical side, I'm looking more for brandy. That's going to help me with the medical side of what's out there. That's my quick lecture on that. So, but here's an example of some strains that are out there where we have some strains, Northern Lights, OG Kush, and here's the dominant. Now, terpenes come in dominant. There's usually a dominant terpene and then some terpenes underneath there. These are some of the products, the actual strains that you can look at that'll actually help you with your sleep. That's going to help you be able to get to the sleep that's there. And if you notice, a lot of these things are fairly high in THC, although they can be indica-leaning, meaning you're not going to necessarily get all excited. It's going to relax you. And I find that to be very, very fascinating. You want your body relaxed, and you want to be able to get into that, lower the inflammation, lower the pain. It really helps you quite a bit. Your comments on that, Lisa?
Yeah, and what we do at INSA is we list the top 3 dominant terpenes right on the can. And so myrcene is the most common terpene in cannabis. And so you're going to find that one a lot. So that one won't be too hard for you to find. And your granddaddy purples, a lot of your purple cultivars will have a lot of linalool in there, which is good because again, it helps you remember that lavender is purple. And so a lot of your purple names often have a lot of linalool in there as well. And so pay attention to what's on the can, pay attention to what your associates that you're working with are telling you what's in there in terms of terpenes. And one thing that's a really great idea is to keep a journal. If you're trying all of these different products in a week and you realize that one of them helps you so much more than the other, you might have trouble remembering, well, was it the Granddaddy Purple, or was it the Northern Lights, or was it the GMO, or was it the Runts? And so if you keep a journal, of just, how you're responding to these, it's going to make you all the more prepared when you're going into these dispensaries. And if you tell them, oh, I really love that OG Kush, it really helped me out, your associate's going to be like, oh, well, OG Kush tends to be high in myrcene and has some other terpenes that are dominant in there. Let's see if we can find you something that's a really similar profile.
Sure. I know one of the questions we had from an anonymous question was, it says, when I smoke pot to sleep, I get too wired to sleep. Is the specific product, is there a certain pot that simply relaxes me and makes me sleepy? Well, the answer is yes. Here you go, right here. Here are Granddaddy Purple, Northern Lights, OG Kush, and you see, notice they're all indicas, okay? Notice that the top reported effect is sleepy, that's over here. And that's as opposed to something like a Blue Dream, which is more of a sativa. And if you're smoking something that's a sativa, or you're using a product that's sativa heavy, it's gonna be harder to fall asleep. You get more energetic, but you're not gonna necessarily fall asleep. If you stick to the indica sides over here, that'll help you quite a bit. So the answer, yes, is strain. Candidly, the terpene profile of the strain will help you be able to determine whether it'll help you fall asleep or not fall asleep. You probably look at the product that you're using. It's probably going to be a sativa, and it doesn't have a lot of the terpene profiles that you need to fall asleep. I'd say that's probably what's going on with you right now. I don't know what you're using, but I'm just saying that's a pretty good guide to see what's there. CBN, we had a question of, will you speak about CBN and sleep? The answer is absolutely. Now, CBN has been known to really help with people fall asleep. What's interesting is when you look at it from like a cannabis practitioner standpoint, from like my point of view, what we have found out is that it does a number of different things. It's non-intoxicating, which is great. Okay, and that's something that's important because it's harder to be intoxicated and fall asleep sometimes. But also it addresses pain as well as insomnia. the question becomes, if you have less pain, it helps you fall asleep. Is that good? Is that what it's doing? Or is it helping you fall asleep? And the answer is, who cares? You CBN and it works. We're not trying to have you be a lab rat and test you to death to figure out what's going to work. We know it does work. Okay. And it does work because it's not only helping you with pain, it helps a lot with anxiety, which is another reason why people can't sleep. And the net therefore translates into things where it helps as they get less anxiety, less pain, it helps them go to sleep. And again, being a CBN molecule, it's not necessarily intoxicating, which is really, really important. I tend to use cannabis. Like I have 7 herniated discs in my neck and 2 in my back from an auto accident. That is no picnic. It's inoperable. Let's put it this way. I shouldn't say inoperable. Even the doctors are saying the risk reward is not worth going through the operation. So I have to kind of live with it. And so I'm looking for things where I can address the inflammation, address the pain, and still be able to work on a daily basis, do webinars like this, and still be able to sleep. And CBN is definitely a part of my regime, not to fall asleep, but to help me with pain. Okay, and that has a lot to do. It has a lot of different properties: antibacterial, um, neuroprotectant. What does a neuroprotectant mean? There's a question here. I know that Joe, you brought up a question about neuropathy. Neuropathy is where the shield of your body, your receptors, has fundamentally been stripped away. And what happens is it's kind of like it's exposed to the world. It's kind of like when you cut your skin, you're more exposed to the world that's out there. It's very similar. That's what's going on inside your body with neuropathy. You want to find something that's a neuroprotectant. And CBN, a lot of the CB products are all neuroprotectant, and they help quite a bit. In fact, I have a patient right now I'm working with who's going through some treatments, and one of the things we're helping him with, one of the things that's helped him tremendously with, is medical cannabis, and a lot of medical cannabis, especially with leaning towards a lot of the CBN that's there. So the neuroprotectant, answer your question about what's the best product for neuropathy, I would say CBN is good for it. And I would say any of the CB products, but also make sure you have some THC in there, because that triggers the effectiveness. Again, 1 and 1 is 3 that's there. I'm going to do a webinar early in the year in January on neuropathy. So we'll actually send you an email, invite you to that particular seminar. And what I'll do as a follow-up, Joe, I'll get the strains and terpenes that we're going to be recommending. We'll send those to you as a follow-up to this webinar, if that's okay with you. But again, that neuroprotectant is really important. It helps a lot with glaucoma. I know my mother started taking medical cannabis for, she had a cancer. She was diagnosed with breast cancer, and I prescribed some things for her. And she came back and called me one day about 3 weeks later and said, I went in for my glaucoma and it's gone. The doctor couldn't believe what was going on. And when she told him what she was doing, the doctor said, yeah, it's really good for glaucoma. So it's something that's really there. Yeah, the answer is yes, CBN is very, very effective. And I hope that it covers a little bit of it. We have a seminar coming up next quarter also on cannabinoids. We dive into this a little bit deeper, but as a quick answer tonight, I hope that answers a lot of what's there. I think some of it has to do with routes of administration. It's something that how you use it is just as important as what you use. And I say that because going back to where some people say, I tried this, I smoked a joint and it didn't work. Why didn't it work? Well, good news and bad news. Good news is, let's start with inhalation as one of the routes of administration. Let's start with flower. You roll that joint, put it together, go to light it, and you take that 500-degree plus temperature flame and put it up to the joint. What you're doing is you're burning off half of the cannabinoids, all of the terpenes, and all of the flavonoids. So you've basically reduced the medical efficacy of cannabis down about 60% the minute you light a joint. Okay. Now, that's the bad news. You know what the good news is? It works. People have smoked cannabis and it's really provided the relief they need. So imagine if the car is running at only 40% capacity or throttle, and you're getting the results that you want. Imagine if you could do the 100% or even 50% or even 60%. That's one of the things that's fascinating. I know that there's a lot of people that say, well, I can just smoke a joint, it'll work. Probably not. And the reason that probably not, people smoke a joint, it doesn't work, but they try medical cannabis and it does work, is because you're getting rid of the terpenes. And those terpenes are critical to have it work. Now, can you inhale? and be able to get the terpenes? I'm going to talk about inhalation, about how safe it is in a moment, but the answer is yes. Those are called concentrates. Is that right? So Lisa,
Yes.
you're a concentrate, no offense, concentrate queen. Tell me about it.
I take that as a compliment. Thank you very much.
It's meant as a compliment, by the way.
So yeah, concentrates are any product that has a concentrated amount of cannabinoids or terpenes or terpenes. And so what's great about concentrates is that they're almost always vaporized.
Mhm.
Now, a lot of the time, I would say the majority of the time, you're going to get it inside of a vape pen, a vape cartridge, or we have this style of vaporizer at Insa called a dart pod, which is really easy to use, nice and
Good idea.
compact. Really good airflow on it as well. And what's nice about those is that the vaporization temperature is much lower than combustion.
Right.
And so you're not burning off all those terpenes and the cannabinoids. And so it's much more efficient. So not only are there more of the good stuff, but you're able to absorb more of it when you have that inhale because it's not getting burned off.
Right.
And we have a wide range of different, vaporizer options. And so you're definitely going to want to look for, if you're trying to get something for sleep, something more on the indica side, more sedative than something like a sativa, which is sort of more meant for, getting you through the day and sort of replacing that cup of coffee that you're going to have. And so vaporizer pens and, other styles are really
Concentrates you
convenient.
use in a pen as well, right?
What's that?
You have a pen used for concentrates as well.
Yeah. And so there's also different kinds of concentrates that aren't already sort of pre-packed, like the vaporizers that you see on the screen are. Things like waxes, batters, and so forth. And those you can actually buy a little electronic vaporizer pen and you pack the concentrate in there.
Mhm.
The benefit to that is that there's usually a wider
like
range
this.
of options to choose from. Yeah, exactly.
Right.
There's
And you open it
usually
up
a
and
wider
you
range.
put the concentrate in the top, right?
It's not that difficult. And usually there's always really easy to read instructions that come with it. And if you have any problems, the associate who sells it to you should be able to walk you through it.
The key is when the cannabis plant is from seed is being grown, the first thing it does is produce CBG, and then from there it produces CBGA and CBG THCA. Those are the two cannabinoids. Those are not those won't get you high. Those will help with inflammation. Those will help with pain. Then, based on either time or heat, it then produces THC and CBD that's up there. So if you can get THCA and CBDA, if you can produce a product with that, you can actually address pain and inflammation without necessarily getting high. And so the answer is, I actually produce I make my own. To be candid with you, I take flour that I buy from a dispensary. What I tend to do is I have a machine called a magic butter machine. I put it in there, put in some MCT oil, and I drop in some cannabis, and I cook it for about approximately 10 hours at 160 degrees. Now, why 160 degrees? Because it's about 200 degrees that CBDA and THCA triggers the CBD and THC molecules. So by keeping it temperature down, what I'm doing is I'm releasing the THCA and CBDA, but I'm not producing the CBD and the THC. So I have a product, a tincture drop that I take in the morning, the middle of the day, and in the afternoon that works for my pain and my inflammation, but won't get me high. And for me, that's really important because look, 7 herniated discs in your neck is just no picnic. I mean, to be candid with you, I can wake up in the morning in a level of pain of 7 or an 8, sometimes a 9. Literally, by being able to take those tincture drops within 20 minutes, that pain level will drop down to probably a 1 or 2. And to be blunt, I actually grab a vape pen that I can set the temperature on. What's cool about, I think I showed you this little vape pen here. It has a little little button in here, and you can push it. It has 3 different temperature settings. What I'm able to do is, remember I talked about the 500 degrees, it burns off all the terpenes and all the flavonoids. Well, if you set that temperature setting at 300 degrees or 320 degrees or 375 degrees, you get the terpenes, you get the cannabinoids, you get the flavonoids. You're not burning them off, which is what you want, but you still get the flower experience. Hence why I believe concentrates and vape pens are really the way to go, especially the ones that have the right terpene profiles. there's actually vape pens you can get now that have rosin and resin in there, which
Mhm.
is very high and it's very, very good for you. So it's something to take a look at. It's not just a matter of what product you use, it's a matter of how you use it. And again, I see a lot of folks that say, gee, I smoked it, it didn't work. Well, yeah, you put that 500-degree temperature up there, you just took away the medical efficacy. So if it's not there, it's not going to help you. Pay attention to potentially taking a look at some concentrates, taking a look at some vape pens. Inhalers are really good, something to take a look at in that particular category. Um,
And I will just say about the inhalation method too, is when it pertains to sleep, that's going to be a really great option for those who are having trouble falling asleep,
mhm,
because you feel the onset almost immediately.
mhm,
And so, if you're having trouble just initially relaxing, winding down at the end of the day, sort of shutting that brain off
mhm.
so you can get some Z's, then, an inhalation method or a sublingual method, like you mentioned with the tincture, those ones that, kick in much faster are going to be a really great option for that initial onset of sleepiness.
Right. Now, here's what's interesting. Inhalation works almost immediately, and you
Mhm.
have a 2 to 6 hour, depending on who you are. It works. Typically, inhalation works for me for about 3 hours, to give you an idea, 2 to 3 hours. Okay.
Mhm.
Now, let's contrast that. I'm going to go over to sublingual drops for a second because sublingual is how a lot of people start. They put a drop underneath their tongue. It helps them be able to, it absorbs through the mute the inside of you have blood vessels inside your mouth that help you absorb the cannabinoids. What it does is it then goes into your digestive system. And what's interesting is probably takes, they say, 15 to 30 minutes, in my case about 20 minutes, but it'll last 4 to 6 hours. Most of the time, my sublingual drops will last me about 5 hours, to give you an idea. So in my case, I have herniated discs in my neck. I can't take it in the morning and hope the rest of the day I'll be okay. Because by 2 or 3 in the afternoon, my neck is tapping me on the shoulder saying, hey, I need a little help here. So I have to do something in the morning, in the middle of the day, and in the evening. And so what's interesting is those sublingual drops will help me get started. But I take a vape pen in the morning. I actually have a concentrate pen that I take a hit out of, take 1 or 2 hits. Literally immediately, my pain level goes down to a one, one or lower. And then by the time the sublingual drops kick in, I'm able to keep that for that 5 or 6 hours that I really want to be able to do that. So mixing and putting these together helps me get that coverage period that I'm really looking for.
Yeah, absolutely. Like that's one thing that's amazing about cannabis is that there's so many different ways to use it. It's not just smoking a joint. There's a lot more methods of use that you can tap into. And when it comes to sleep, you have, if you have problems both falling asleep and staying
Mhm.
asleep, then you can mix and match these methods.
Right.
And so you can have that inhalation method that gives you that onset of sleep.
Mhm.
And if we move over to the oral part, if, a lot of times that's considered edibles. If you ingest an edible, that lasts usually for a lot of people 6 to 8 hours minimum.
Yeah,
And
sometimes as
so
long as 10 hours.
exactly.
Yeah.
And since you already have that onset of sleepiness and you've already sort of fallen asleep, then while you're sleeping, you have the edible sort of kicking in that's going to help you stay asleep.
Right.
And
But
so
this is
by
very, you brought up an excellent point. Now, before we jump in, we're going to skin that cat. I think that's worth talking about. But oral, be careful. Edibles, first of all, typically can take as long as 2 hours to work. Most of the time can take about an hour to work. There's the famous stories. Everybody's got their famous story of somebody who you say, well, try this edible. They try a little bit of it. It does 15 minutes later, it doesn't work. So they take another one. And then 15 minutes later, it doesn't work. An hour later, they take another one. It takes 15 minutes to take another one. So over an hour, they've taken 4 times the medication that they should have. And they worry about an hour and a half later why they're anxious, they're high,
uncomfortable.
comfortable. Okay. Or if they want to get high, I guess they are comfortable. But I'm just saying be careful because with edibles, be cool, baby.
Yeah.
Let them take effect. They will work. Now, what I love, so for those, I think there's a comment in here about Carolyn made a comment. Very good question, by the way. This is very interesting. My question is medical marijuana helps me fall asleep. Wonderful. But my witching hour is about 3 a.m. I wake up and I can't go back to sleep. I'm afraid to take more. Does it cause the sleep? Because it causes me to sleep way more than I use. So what's happening is very simple. If you smoke cannabis, it's going to last 2 to 6 hours. take it at 10 o'clock in the morning, at 11 o'clock at night, 2 to 6 hours, takes you into that, 3 o'clock in the morning. Same thing with sublingual drops. They wear off. They've worn off. So what's happening is your body is saying, okay, help me out here. Now, what I found is, and I know it's a tough road to hoe, but I take a chocolate every night before I go to bed. About an hour before I go to bed, I'm a chocoholic to begin with. And I found that by taking a little bit of chocolate about an hour before I go to bed, not only helps me fall asleep, but because for me, chocolates will last about 10 hours, it helps me stay asleep. So I guess what I'm trying to point out, Carolyn, is this route of administration you're using is working. What you're telling me is it's working. It's working 2 to 6 hours. What you got to find is a route of administration that works through the night. And I'd recommend taking a look at an edible that has a terpene profile. And if you like chocolates, join me, become a chocoholic. It's something that I find it's very, very fascinating. But again, don't buy a THC only chocolate. Get something that has a good terpene profile in there that'll help you throughout the whole night. That's really there. Your problem, Carolyn, is more the route of administration as well as the product itself. Using it 3 o'clock in the morning, you'll get another 3 or 4 hours out of that if that's what you want. That's the time frame you're looking for. But I'd recommend to take a look at an edible that has a good terpene profile, and there's a lot of chocolates. Now, I deal with a lot of dispensaries, and I can tell you 70% of the products that I have in the edible categories don't have terpenes in them from a lot of the dispensaries. And that's why I tend to work with dispensaries that have a terpene profile, because really I want to provide relief to the patients, not just a high. And I think that's one of the reasons I work with Insa. You guys have some great products that help you in that particular category. Any comments about the chocoholics, Lisa?
Yeah, well, I mean,
Food
I
for the
gotta
night?
say, I may sound biased, but I'm also a huge chocolate fan, always have been. I used to get teased for it all growing up by my family. But we have the best chocolate that you're going to be able to find on the market. Our head of edible creation, Julian Rose, is a master chocolatier and has been in the business for over 40 years.
Mhm.
And so he knows what he's doing. And he's created not only like some delicious milk chocolates, but we're coming out really soon with a wide range of flavors for you to choose from.
Mhm.
And so definitely come in and try our chocolates if you enjoy it. If they're not your cup of tea, then you can come in and try a gummy. And we have a pretty wide range of those coming in. We got some, watermelon, strawberry coming down the line. We just released a green apple.
Right.
And so you have options. You have options when it comes to those edibles. If you're not a chocoholic, I mean,
Yeah, Julia, you had a question that says you're allergic to chocolate, and
there you go.
it's too bad. I mean, but on the other side of the coin, what Lisa was just pointing out, there are other edibles that fall in that category that'll get the job done for you. So the
Yep.
answer is yes, there are orals that you can take for that. Also, Anne asked a great question, and that is, does inhalation affect the lungs? Well, first of all, anything that you put into your lungs affects your lungs, or not. Now, on the other side of the coin, for years, when people have had lung problems, they've had bronchial inhalers. The medical community has embraced bronchial inhalers because what does that do? It puts the medicine that your lungs need into your lungs, gets to those receptors, get to those nerve endings in your lungs, and helps to be able to provide the medicine it needs for that. Cannabis can do exactly the same thing. Cannabis is not, unlike cigarettes, which are carcinogens, it's not a carcinogen. That's why there's bronchial inhalers, or that's why there are inhalers in the market for cannabis, because it helps with a lot of the lung conditions. A lot of doctors will recommend it for that. They'll recommend inhalers for that. Now, I don't recommend that if you're just buying weed on the street and smoking it, be very careful, because God knows what's in it. Okay. And that's where you run into problems with that, right? Get it from a trusted source. So you're buying something that isn't going to be tainted with something or laced with something that really causes a lot of problems. But I think that
Vaporizers too.
the answer to your question is, if you buy from a dispensary that has been certified by a state or some organization, or a quality dispensary that does the testing like Insa, then you're going to buy a product that's going to be good for you. They test most of the dispensaries here in Florida. In fact, the dispensaries in Florida here are regulated to do 2 tests in their own facility and then 1 test from an outside group. So it's best tested 3 times, which means that, can you trust it for an inhalation product? The answer is yes. Why were there problems years ago? with inhalation products because they came from Asia. They were not tested, they were not regulated, and they had products in there that candidly were bad for you. And they actually couldn't even find the people who produced them when they went to track down what was going on. If that had been tested, you wouldn't have had that problem. So again, what I'm trying to point out is, yes, it is, you always have to be careful about what you put in your lungs. But if you get a product from a medical cannabis dispensary or one that does the testing, then you probably are going to be in some pretty good shape. That's really out there. And again, talk to your doctor, because if you have a severe lung problem, we want to be able to address that. We can address it from a cannabis standpoint as well as from a doctor standpoint. But I don't want to give you a blanket statement when you may have a lung problem. Okay, let's take a look at that. But in general, it's very safe. It's very safe to use. That's really out there. We have a question came up of topicals. So Lisa, let's talk topicals for a second. I love topicals because you basically put them on and they immediately work. Now there's a couple of different flavors of topicals. There's a regular topical and then there's transdermals. And why don't you explain the difference between them and how they work?
Yeah, absolutely. So lotions and salves,
Mhm.
those are a type of infused topical where you apply it to the area that's experiencing discomfort. And so say you have a really sore back and that's what's preventing you from falling asleep.
Mhm.
If you put a lotion or salve on there, it's going to work fairly quickly in reducing that pain and inflammation.
Mhm.
And the additional benefit to a lotion or a salve is that even if it has a high amount of THC in there, you're not going to feel intoxicated. The way your body absorbs those lotions and salves, those infused ones, is that basically the cannabinoids get trapped in that lipid layer of your skin and it does not get deposited into your bloodstream. And so since it's not getting deposited into your bloodstream, that THC can't travel to your brain to make you feel high. Now,
Mhm.
transdermal patches, on the other hand, have been formulated to deposit those cannabinoids into the bloodstream. However, it does it at a very low rate.
Mhm.
I've seen patches that are typically like 2.5 milligrams of THC every hour or so.
Right.
And that's a very, very minuscule amount. And so if you
I
have,
think you call that
higher level.
microdosing. You call that
Yeah,
microdosing.
exactly. Yeah, it's microdosing. And so while there is the potential for some inebriation, the likelihood of it is very small, especially if you have something that's like a 1-to-1 ratio of CBD to THC. And so those are the two main differences between a topical, like a lotion or a salve, and a transdermal patch, is that one can theoretically get you high and the other one cannot.
Transdermal
The other
breaks
thing that's
right through the dermis. It gets right into your bloodstream. Now it's
right.
much more effective, but you have to also be a little bit careful of it. But I think transdermal, especially transdermal patches, are just great. They
Yeah,
help me
and they
during the
tend to
day.
last a really long time, whereas with a lotion or a salve, you do have to reapply.
Right. It's there. I know. So there was a question. I think it kind of half disappeared on me. So let me see. Let me see if I can pull it up here. Um, yeah, here we are. So you had an anonymous question about if I put it on, they were worried about, they talk about putting it on into what they call a venous area, an area that has a lot of blood flow. Or you can put it on where you actually have the problem itself. And he talks about how if it goes on the product, it's a problem where the product is or the problem is happening, it gets absorbed into the fat cells. Now, this goes back to really something called transdermal or just a lotion. Okay. First of all, when you put it onto a venous area, the cannabis goes into your bloodstream. That's how endocannabinoids are transmitted throughout your body. That's how the endocannabinoid system transmits the endocannabinoids is through your bloodstream. So by putting it on a place where you have a lot of veins showing, like inside of your legs, inside of your arms, it does help you address that particular area because your body says, Houston, we have a problem. Send some endocannabinoids to that area, and that's what it does. Very fast, and that's how the endocannabinoid system works. Now, if you put it right on the area itself, not only does it send those endocannabinoids to that area, but in many cases, it addresses if it's an injury, if it's a bruise, if it's something that's there, the cannabis actually helps the muscle tissue more effectively or more immediately address that particular issue. So one is, do you want to be able to address the injury or do you want to be able to provide the cannabis that's there? And I hope that answers that question because both of them are effective. But I have found, like, for example, with my neck, I prefer to put it on my neck directly rather than to an intervenous area because I found it just helps me a lot better. Because I'm trying to get rid of inflammation as well as pain, and I found it just works a lot better. Let's put it that way. And I hope that answers that question. I know it was a long answer to a question that's really there. Um, okay, so let's go back up. Carolyn asked a really good question since we're on routes of administration. She asked the question of, I still have a glass of wine with dinner. Is it safe to use medical marijuana pen afterwards? The answer is yes, it is safe. But let me give you a little known fact that people don't know about cannabis. If you use cannabis with alcohol, it multiplies the effect of the alcohol by as much as 8 times. Okay, you will get higher on from the alcohol if you use cannabis than if you don't. All right, it'll give you somewhere between 2 to 8x that's there. So the answer is yes, you can use your pen, and you probably are going to feel a lot better afterwards. But I don't recommend heavily drinking and using cannabis because you take that and you multiply that by 4x or 5x or even 8x, it can have an effect that's there. A lot of practitioners say don't mix alcohol and cannabis. I'm not one of those. I think you can do that, but pay attention to what you're doing. Be an adult, okay? You're think about drink. That one drink now equals 8, okay? So if you're going to do that, be very, very careful. So the answer, Carolyn, is yes, but understand that you'll probably get a much better reaction from the wine than you did just using it by itself. I hope that answers that question. Yeah, Carolyn, you have any comments on that? Carolyn, do you have any comments on that? I'll let that go. Okay. Um, so let's see, let's go down here. Um, so one of the questions that comes, how you get terpenes, CBN, CBD, and THC without smoking? The answer to your question is you probably will get more of them by not smoking than with smoking. So how do you get them? You get them by getting concentrate products that will help you with those products in there. Sublingual products have terpene profiles that'll help you quite a bit with those particular areas. A lot of edibles have terpene profiles, so pay attention to those, and your topicals will too. So I hope that there's a number of different routes that really would help with that, that are out there that you can take a look at, and I hope it makes a lot of questions. Hey,
And you
Clark
can
asked,
mix and match a little as well.
yeah, mix and match.
Yeah.
Clark asked a great question. I know suppositories are very popular. You don't make them at Insa, do you?
Not yet, but it is something that we're looking into.
Yeah, I know that a lot of people are they use them for a number of different reasons. I know one of the things that it's found very well is it helped a lot of ladies with their issues, their periods.
Yes.
I know it's helped a lot with IBS. It's helped a lot with cancers. Okay, so suppositories are very effective, very, very effective. And they're just starting to be made and being put out there right now. And I hope that answers that question.
Just pay attention that the suppository you're buying, you wouldn't necessarily want to use one that's designed for anal suppositories. You wouldn't necessarily want to use that in your vagina. Just want to throw that out there.
Yeah, that's a good point. Yeah, now there are those for different body parts. There are
Yes.
different suppositories for that, and that's important that it's out there. All right, so Julia had a great question. It says, my friend in Massachusetts told me about sleep products with combined cannabis and melatonin. Do you have these in Florida? The answer is I don't know of many dispensaries that have it, but I'm going to give you a site called My Botanical Wellness. That it's a CBD. I actually put out a site that has CBD products, and you might say, why do I do that? I'm not trying to compete with Insa. I know that having CBD when you're going to do your dosing is very important because if you start getting high, if you take an equal amount of CBD, it brings you back down. And I recommend that for patients. And as we did that with the 25 clinics that I was working with, they started asking a question of where do I get a quality CBD product? And I went out and tested and found out that gas stations aren't the place to go. And a lot of these head shops aren't the way to go. So I've actually had doctors look at the products. That's why I put together the website. These are tested by doctors. They're tested by physicians. They all go through the same rigorous testing with 2 in-house tests and 1 outside. And there is a product on that website for sleep that does have melatonin in it, and we're running a special this week. So I'll talk about that in just a moment. We'll talk about that site. So that's
And
why
we
I know
have those in Massachusetts at
Pardon?
INSA. And we do have sleep products with melatonin up here at Insa. So
Oh,
if you ever
fantastic.
make the trip up here,
Do you have them in Florida?
not yet. I'm not sure if we have those in the works just yet. I think there might be some regulations against it, but I would have to double check that.
Well, I think it's also a matter of getting approval. I know
Yeah,
you're going through getting a
exactly.
lot of your products
Yeah.
approved that are right now. Margaret asked a question. What can I use in Texas, which is a low THC, 1% only state? Fundamentally,
It's
don't get
tough.
me started on Texas.
That's
The
tough.
medical marijuana program. 1% THC is not a medical marijuana program. Basically, what you've got is a glorified hemp-based CBD product. That's basically what you've got. And cannabis products at 1%, it takes away a lot of medical efficacy of those products itself, like PTS, like pain, like a lot of anxiety conditions. I just think, again, politicians need to stay in their lane and leave the medicine to the doctors that are out there. And if they can't find doctors that know about it, call me, okay? Because I mean, it's something I educate a lot of politicians, and it's amazing. I mean, and in defense of them, they've never been taught this, so they just don't know. But I think once they know, they kind of go, "Wow, this is kind of cool. How come I haven't heard about it?" Well, because when you have a Schedule One drug and you suppress it for 60 years, like the government's done, that's what happens. Anyway, the point is, um, you're going to have to probably stick to the products that they have on the market. And unfortunately, in Texas, at a 1% cap, it'll help you a little bit. You might. The answer is, can I take more of it? Yeah, you can. But I think the only answer is, hopefully they'll remove that restriction and make it a lot easier for you. I can't change. I can't change the laws of gravity. Let me put it that way. That's really out there. Um, let's see. What else is a good question in here? Uh, Cynthia asked a question. It says, "How do I avoid the morning hangover I've been experiencing with edibles? I take them at 7 a.m. or 7 p.m." Um, Cynthia, in your case, edibles last longer than 10 hours. Best way of putting it. Every person's body is different. Look, I have friends of mine who, when we go drinking, I have one friend that literally has one martini and he's done for the night. I mean, we've known that for years. Okay. I have other friends that I've met. Had the ambiance of living in Europe for a while, and I learned not to drink with the Brits and with the Germans. I can't stay in their league. They can drink the whole bottle and just get warmed up. Okay. Cannabis is the same way. Some people can have high tolerances and low tolerances. What I would suggest you do is, if you have like a chocolate, cut it in half. If you have an edible, cut it in half. Reduce the amount that you're taking in half. You'll get the same effect. It's just you won't have the hangover the next morning. I think that's going to probably be the answer to you, because it turns out that your body is very susceptible to the THC part of it or whatever is there, and that's what's causing the hangover that's there. Reduce it in half and see what happens, and that should be able to help you quite a bit. Um, let's see. Let's go down here. What's the difference between using THC, CBD, and CBN versus THC with melatonin? Oh, night and day. If you're using a combination of products like THC, CBD, and CBN, that's going to be much more effective to you. I think I went back. I think I showed you this slide back up here. Let me go back up here. Right up here. When he talks about melatonin, melatonin is really addressing a lot of this receptor right here. That's what it's basically affecting right in here. And it's also affecting GPR55 as well as the TRPV2. So what's interesting is, if you have a product like THCV and CBD, the right CBDs, they'll do the same thing with as melatonin that's out there. Melatonin is kind of like if you buy a espresso and you get another shot, that's what you're doing with a CBN. That's really out there. You don't necessarily need to have it if you have a high quality product that has those in there, and I hope that really helps. Let's see what else we got in here. One good question. I love these questions.
Yeah.
I really do. It says, I've been hearing advertising from companies that tout the benefits of CBD oil and gummies for erectile dysfunction. Is there any truth to this? And is there any hype to selling the gummies? Well, first of all, let's back up. Let's talk about CBD products, which are hemp-based products, which are high in CBD, low in THC, probably 0.3% THC or less. The combination of CBD with THC works together, and what can happen is it's very good for inflammation. It's very good for pain. And in certain cases, it's very good for anxiety and for stress. It gets you to relax. Now, where does a lot of the sexual dysfunctionality come from? People get nervous, aka anxiety. People get concerned. This isn't something like your body stops working. Your body is working. It's a matter of having your brain and your body connect together to get over that. And a lot of times when you relax, you get rid of the pain, you get rid of the anxiety. It works great for that. And that's what they're really talking about. They've had people that have had that effect by taking it. Their ergo, it works for the erectile dysfunction. I would not advertise it that way. Let me put it to you that way. I think that's a gross overstatement. And I've not seen anything in medical literature that talks about CBD products helping with erectile dysfunction. I have seen medical literature about using medical cannabis products with a higher amount of medical marijuana that have helped with that particular area. But a lot of that has to do with, when you read that research, it has to do with addressing pain, anxiety, and inflammation, candidly helping with blood flow, because in certain cases people have problems with blood flow, and the THC helps with the blood flow that's out there, and also helps with anxiety. So I hope that answers that question. I would just mark that off as a gummy off as overselling the gummy that's there. Find yourself a medical marijuana dispensary. Grab a couple gummies. They'll probably be more effective than what you're currently using out there. Theo, Phil. I'm not gonna pronounce it. I'm sorry if I destroy your name. Theo Phil. What dose do you recommend starting for sleep problems? Dosing is a whole discussion in itself. And if you go back to our webinar series, we have a whole webinar on this, excuse me. Please watch that. It depends. It really depends on you, your body, and what works. And that has to do with dosing. What you really want to do is you really want to be able to go low and go slow. Try a 1-to-1, try 0.5 milligrams. If that doesn't work, up to 0.5 milligrams. If that doesn't work, or milliliters, excuse me, that doesn't work, increase it to 0.75. But dose and find out exactly what works for you. I can't tell you that. I'll tell you who's going to tell you that. It's your body. When it starts working, your body says, hey, it works. Listen, when I was dealing with this pain and I was going low and going slow, when I found my sweet spot, my body knew it and I knew it. And it was like, whoa, this is where I want to be. When I use too much, the pain started coming back. It has a biopic effect and it causes the pain to come back. So I aced it down. But when I found that sweet spot, it's really there. My doctor can't tell me. And candidly, I go to a lot of doctors' conferences. I shouldn't say I go to a lot, I go to some doctors' conferences. And I've had doctors talk about just even pharma drugs that really they can't figure out how to get the formulas right. They have a guide that's given by the person who produces it, but they have the same problem. Every person's body is different. At least we're upfront about the cannabis world versus the pharma world. But anyway, it's something that's really there.
And I would say if you're thinking about vaporizer pens, one puff and wait like a good 20 minutes. And then see if you want to go back for another puff.
Mm-hmm. Yeah. Clark asked a question that says, help with back pain and nerves. Suppository is experiencing my question. I hope you could get them. I've been looking for them. Can't find them anywhere. There is one dispensary that does sell this, suppositories, but they're not producing them right now. Okay, so I would pass it on to you, but it's just, if you get a hold of them, they'll just tell you that they're not producing them right now. Why? I don't know. Okay, I don't have a good answer for that. But I do know that if you have back pain, which is what I have, trust me, I don't use suppositories. What I use is I use a combination of a vape pen and the tinctures. And to be candid with you, I've become a concentrate person with the right kind of terpenes profile for pain. And it's made a big difference. So I would suggest look at your route of administration. It could help you quite a bit. Go to vapes, go to sublinguals, and to be blunt, go to orals. You know, try that chocolate or that gummy in the evening. That can help you quite a bit. It's really there. Okay.
And also our higher ups at Insa that they're not widely available in Florida. And I'll see if we can maybe get that fast tracked, because that should be an option that you should have. And so right. I'll use what swing I have
yeah,
to try to see if we can get that out there for you faster.
Now, we've had a couple of questions that come into play. It says, when is the Villages Insa going to open? I think you're talking about like December, right?
Yep, we're hoping December. It got pushed back a little bit because of Hurricane Ian, but we're still on track for, hopefully, we're thinking around mid-December. A really great way to know is if you go to our website and you sign up for Insa Insiders, you'll receive emails, or you can even sign up for text messaging, and they'll let you know for sure when we're going to be opening up that location. But we're really looking forward to the villages for sure.
Yeah, Ian was something that set us all back a little bit.
Yes, yes.
And I know that Caroline asked a question, where can I get Lisa's chocolate? Well, you can get it in Tampa, right? You can get them also in Clearwater, all right?
Yep.
Hopefully we'll be getting them in the villages in December. And also you're opening up in Tallahassee as well.
Yes, we're really excited. We're going to be opening up there hopefully in less than a week. So right now we're shooting for the 15th. You know, these things kind of change sometimes. And so we're hoping that's going to stay our deadline, but we're hoping we're going to be opening up in Tallahassee on the 15th. And if you want to know which location is closest to you, you can always go to insa.com and type in your zip code, and it's going to let you know which one is, you know, how many miles away. And so that'll give you a good idea of what location is going to be best for you. Or you can even just call us.
Cynthia asked a question, says addressing the villages. I think you're going to really be in Summerfield. I don't have the address, but it'll be on your website pretty quickly.
Yes, it will be. Yeah.
We're doing a seminar, excuse me, next week in the villages. So we'll be actually giving out the address at that. I don't have the address right now. Otherwise we give it to you.
Yes. And our head of Florida is going to be there. So we're really excited.
Cool. Now, routes of administration. We talked about different ways of using it. I'm just matching that to your product.
Yep.
And one thing I want to point out, it's really interesting. All these products are white. When I first started working with Insa, I went to their website in Massachusetts, and you have some of the most colorful and beautiful packaging I've ever seen. And then when I went into your store in Tampa, there was all white. The reason for that is because state of Florida requires everything to have a white label with THC on the inside. And I think it just takes away from a lot of the packaging. But you can match the routes of administration to different products.
Yeah, you know, we would love to have our original branding on there, and maybe down the line, if regulations loosen up a little bit, we can, you know, put a little splash of color on there. But hey, it's more important that we're getting you the products that are going to work for you more so than making them look pretty on the packaging.
Sure.
And so like we've discussed throughout, you know, this presentation here, if you're having trouble falling asleep, look for our vape pens, look for our dart pods, look for our pre-packed chillums. Those are going to give you the fastest onset. Look for those tinctures.
Your tinctures?
Yep, exactly. You know, if you're looking for something that'll maybe help you stay asleep, as well as maybe even give you a little bit of that onset, like how you use them, you know, look for our chocolates, look for those fruit-based drops. And soon, very soon, hoping we're going to have the lotions out there for you too. And so if you're looking for something that's not going to inebriate you or give you that high, but it is going to help maybe relieve some tension or pain that you're experiencing, I swear by the lotions myself. I think they're fantastic, and hopefully we're going to be able to get them approved by the OMMU soon, and get them on the shelves out to you guys.
And you have a whole bunch of discounts.
We have a lot of discounts.
And also, you have a good rewards program.
Yes, we have the best rewards program that's out there. And so if you're loyal to us, we want to repay you that loyalty with some, you know, basically credits on future purchases. And so you can see there, every dollar you spend with us is a point, and those add up. They really do add up. And we have some great everyday perks. So if you're a new customer, you come on in, you get two $50 off coupons. You spend $100, you get $50 off. And you can do that twice. Same when you get a card renewal. We know those card renewals can be a little pricey to get. And so we want to take that burden off of you a little bit. And also, I do want to highlight a couple of things here. Veterans Day is coming up real fast here. And we have some really amazing veterans discounts. And so our everyday veterans discount is 20% off. And if you are a 100% disabled veteran, you get 40% off. And that's always. Now, for Veterans Day, what we're doing is on Veterans Day, those will go up 10%. And so if you come in on Veterans Day, come to see us, you're going to get 30% off. If you're a veteran, and if you're a disabled vet, you're going to get 50% off products. And so that's really great. And also, I just wanted to point out, we actually are just releasing some even better sales that they wanted me to talk about because we're starting them tomorrow. And so if you've held out this long, your reward is that you get to hear about some really great savings.
Cool.
You were doing 2 for $70 for 8s for flour. We're doing buy one, get one vapes. And so if you're interested in trying one of those vaporizers to help you lose sleep, you're going to get a free one just for purchasing it. And we're doing 1 penny pre-rolls. And
That's
so it
pretty
doesn't
cool.
get much cheaper than that.
Pretty cool.
And when you come in the next few days, you're going to get a coupon for 25% off to be used later on in the month. And so, yeah, come
And you have
see
different
us.
visit coupons that are over here. One of the things you also do is you have a pretty generous return policy. I know that a lot of times people use the product and if it doesn't work, bring it back to Insa and talk to you. I know that they basically will handle your case one-on-one, but I think they're very good about helping people with their return policy.
Yeah, you know, our mission statement is that we're in business to make your day better. And so a big part of that is by having that generous return policy. If you come in and you try a vaporizer and instead of helping you sleep at night, it's making you wired, come in, we'll give you a credit and, you know, we'll hopefully help you find a different product that's going to suit you. It takes a little bit of the edge and pressure off when it comes to selecting products,
Makes it all there.
for sure.
Well, listen, I want to wrap this up. Naturally, if you want to get medical cannabis products, please go to Insa. A lot of people will ask a question, how do I get a medical marijuana card? I recommend working with MMTC of Florida. Reason for that is very simple. Not only do they have 25 dispensaries throughout the states, competitively priced, but more importantly, they help you with dosing. And really, without getting the dosing straight, medical cannabis becomes hard to use. And that's why I work with them. I just love the dosing program that they put together. And also, if you're looking for CBD products, you talked about the melatonin with CBD, My Botanical Wellness is there. Now, if you use the MMWW10, you get a 10% discount from not from Insa, but from MMTC and also from My Botanical Wellness that's out there. And right now, we're running a special on My Botanical Wellness. We have a Sleep 15 discount that gives you a 15% discount on our sleep products. So please go check it out. MyBotanicalWellness.com. It can help you right there. It's great CBD products. Bottom line, Lisa, is you're not going to get uncomfortably high. You're not going to get addicted. No one's ever died from it.
Nope.
It basically helps you produce your own endocannabinoids. And cannabis has an entourage effect, which is really great, which I think helps quite a bit. So we talked about sleep. We talked about how cannabis can improve it. We talked about the products, the cultivars. I think we pretty much covered it. So.
Yeah. And if you do have any questions, you know, come on in, talk to our associates or even just give us a call, you know, or go on our website and chat with us. Our customer relations department is open from 7 a.m. to 11 p.m. every single day.
Right.
And so if you don't want to make the trip and you just want to talk to somebody first, they're there for you.
Great, which is great. Lisa, thank you very much. I know that this has been very, very helpful. And as Cynthia says, I'll see you next week at the Waterfront Inn. Yes, we're doing a live seminar. We will be there at the seminar. We'll be at the Waterfront Inn in the Villages. But I first of all want to thank everybody. I know we've gone a long time. It's been about an hour 45, almost an hour 50 minutes. Thank you very much for this. We are here really to help you and answer your questions. And I hope tonight, as I mentioned earlier, if just one person gets their life back, if one person can get your life becomes better, and we've accomplished what we wanted to accomplish. And by the way, there's a site that we're going to be putting up. I'll be talking about and sending you called IGMLB. That stands for I Got My Life Back. Tell us your medical cannabis story. Tell us what you used, how it worked, how it didn't work. We're really trying to gather information about how cannabis works and what people are saying. And we'll be sending out some information on that. It's igmlb.com. And it's something that works that's out there. So everybody, thank you very much. We really appreciate it. We do this for you. And thank you for the great questions tonight. They were really good questions. Lisa, thank you very much. And Insa for these webinars. I think this is the last one you and I are going to do this quarter. Is that right?
Yeah, at least for now. It's been an awesome month. Love working with you doing these. And just like you, you know, we love providing this education. I love providing education. I'm very, very passionate about cannabis education. And so I also really appreciate the questions. Questions are some of the best way to learn. And so I'm glad that none of you guys held back on those.
Cool.
And yeah, thank you so much for having me, Marc.
And I look forward to working with you next quarter. This has been fun.
It's exciting.
Again, not only do I want to thank everybody, I do want to mention that next week we do have the seminar and also the webinar in the evening on terpenes. I think it's one of the most important webinars we can do. So Wednesday is going to be a busy day, at least for me. But I can tell you, I think it's going to be something that's really out there. I want to thank everybody for that. And before we sign off, we have a couple people that you've seen in the background. Leah and Lee have been great moderators. Really, they're the reason that this works and it comes off the way it does. And I want to thank them very much for what they do. It's much appreciated. And last but not least, there's a lady named Alyssa Katera who came up with the idea of doing these webinars, came up with a lot of the subjects that are there. It really helped us get started. And I think she needs to have a shout out as well. But listen, everybody stay safe. I know that I'm here in Florida, in Central Florida, and we're going to get the ambiance of the storm. I hope everybody is safe and really has a great weekend. And we look forward to seeing you next week. Thank you very much.